Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
During this critical phase of pregnancy, oral health is just as important as overall well-being. Mothers should not feel that caring for their gums is secondary. It is, in fact, an essential part for nurturing both themselves and their growing baby. Pregnancy is a time of immense change with so much focus on physical and emotional health. So it's so easy to overlook the mouth as a part of that picture. But healthy gums can quietly support a healthier journey ahead. Attending to gum care is not about adding one more task to an already full plate. It's about embracing small, meaningful steps that contribute to a safe and smooth pregnancy. By acknowledging the importance of gum health, expectant moms can feel more empowered and informed in their prenatal care. This discussion is here to gently guide and support mothers in both recognizing and managing any gum related concerns that may arise during this precious time. Welcome, everyone. I'm Dr. Soumya Saluja from THIP Media, and today, to help us understand the essential yet often overlooked topic of gum care during pregnancy, we are joined by the esteemed dental expert, Dr. Amit Bharadwaj. Dr. Amit Bharadwaj is a renowned scholar and practitioner, currently serving as the director of PhD programs at SGT University. Sir also holds the position of professor of the Department of Periodontology at SGT University, Gurugram. He completed his postgraduate studies in periodontology from Vinayaka Mission Dental College, Salem, Tamil Nadu, and holds a master's in hospital administration. Dr. Bharadwaj earned his PhD from SGT University and is recognized as a fellow of the International College of Dentists and the Pierre Posher Academy, USA. Sir's prolific career is highlighted by numerous national and international publications, including authored books and chapters reflecting his profound contribution to periodontal research. Dr. Bharadwaj is an esteemed figure in academic circles, having chaired scientific sessions at prestigious conferences and delivered enlightening guest lectures worldwide. Sir is revered as a mentor, guiding postgraduate students and PhD scholars in periodontology with a keen interest in dental implants, microdentistry, and digital dentistry. Additionally, Dr. Bharadwaj actively contributes to the Indian Society of Periodontology, or ISP, and the Indian Dental Association, Gurugram branch, serving as an executive committee member and contributing as an external examiner for universities nationwide. Sir's dedication to advancing dental education and research is underscored by his election as executive committee member, ISP, for 4 consecutive years from 2021 to 2024. Dr. Amit Bharadwaj, THIP Media welcomes you, sir.
Thank you.
Thank you so much for your time today, sir. Sir, while gum care during pregnancy, I believe is often overlooked or seen as less important. So it's important to recognize that it holds equal significance to the rest of the body's health. So, with that in mind, I'd like to begin this conversation with the most fundamental question here: that what are the most common gum-related changes that occur during pregnancy, and what causes them?
See, in my experience, we face usually 3 complications in pregnant females. First is
Right,
bleeding gums,
right,
fiery red gums, and
right,
secondly is sometimes some polyp may occur in the gums, which usually subsides after delivery, but
Okay.
that needs to be taken care seriously.
Okay. And yeah, please.
So I can summarize in 3 points: swollen gums, bleeding from gums, and swelling means one polyp in the form of gingival overgrowth may occur.
Right. Okay. And what do you believe is the basic cause, the basic underlying cause for these three complications?
Basically, hormonal changes. Estrogen and
Okay.
progesterone are two hormones which
Right.
increase blood supply to gingiva uh,
Okay.
when compared to normal patient.
Okay. Right. And how would you say that this pregnancy-related gingivitis it differs from regular gum inflammation? And how prevalent would you say that it is amongst expectant mothers?
Basically, I want to highlight one thing that this is a mostly in cases of is a reversible kind of disease.
Okay.
Whereas when we compared with normal patient, that is due to local factors, which is known as plaque. Accumulation of
Right.
plaque will induce gingivitis. Whereas in pregnant females, hormonal discrepancies is a main cause, and some
Right.
negligence also.
Right. So you might be saying that it's transient because the hormonal imbalance is just during the gestational period and probably would subside once the childbirth is complete or, the mother has delivered the baby. Right, sir?
True, true, true.
Right. So now, sir, I'm going to come to something which is actually, attracting a lot of attention these days, and that is the impact of gum problems on the maternal health. So now, sir, in what ways can gum problems during pregnancy potentially affect maternal health and pregnancy outcomes?
Okay. So in my experience, there are three problems. First, baby delivered by the mother having gingival problems or oral disease will be of low weight as compared to normal baby.
Right.
And delivery may be of less time span, I can say.
Right.
Means it will not take proper gestation period and baby
Ji.
will be delivered early. And
Ji.
third is pre-eclampsia. So three these
Hanji.
common problems: low birth baby weight, early delivery, and pre-eclampsia.
Ji, sir. Ji. And I'm actually sure that when a mother is going through these hormonal changes, there might be certain signs and symptoms that she should be looking out for or she should know about. So, what early signs or symptoms should expectant mothers watch for to detect gum issues before they worsen?
The first is fiery red gums.
Okay.
The second is bleeding while brushing.
Okay.
And third is bad breath.
Okay, right, right. And what you might suggest that in your experience, of course, that are the typical challenges do pregnant women face in maintaining consistent oral hygiene, and how can these be realistically addressed?
I think like problems like morning sickness can be one
Okay,
cause.
okay,
Negligence due to family pressures can be caused, because if she or her husband say that we want to visit dentist, then
Ji,
people in family will say that these things can be taken up later also. Means they are
right,
not quite negligent about oral diseases. है ना? So
right.
delaying of normal treatment can also be a cause of this.
Hanji, Hanji. Right. And I'm sure agar, they delay their dental appointments, there would be issues and the problems would worsen, of course. So now, what would you suggest should be the recommended approach, to dental visits and cleanings and treatments during this sensitive period so that, there are any, so that, uh, these complications or these gum problems can be prevented?
Yes, they first I will suggest consult your nearest dentist.
Okay.
Then maintain balanced diet,
Ji.
nutritional diet,
Ji.
avoid sugary intake,
Ji.
avoid more starch intake.
हाँ जी.
You can do proper brushing twice daily or flossing once. So these
Ji.
4 5 things, if she can take care of, it will be of
Ji.
great help.
Ji. But that is something that she'll be taking care of at home.
Yeah,
What about if the problems, they generally face and they cannot, deal with and they need professional help? उसके लिए कोई टाइमलाइन होता है कि
उसके
जैसे हाँ जी।
suppose if we divide the pregnancy period in three trimesters, first
जी
trimester, second trimester, third trimester. So
हाँ जी
all preventive care can be done in first trimester itself.
जी
But if she feels that pain is unbearable and she need extraction and she need filling, even for that matter, restoration, root canal treatment also, then
हाँ जी
second trimester is the best.
जी
एंड देर इज ए मिथ दैट इसमें नहीं करवाना, इसमें नहीं करवाना. जब पेशेंट को अगर जरूरत है जरूर करवाना है, बट विद अंडर प्रॉपर केयर करवाना है.
जी।
अपने फिजिशियन को, अपने गायनेकोलॉजिस्ट को लूप में लेके करवाना है.
सर जैसे अभी आपने बताया कि बहुत बार ऐसा होता है ना कि ये सिर्फ एक मिथ है कि आपको डेंटिस्ट के पास नहीं जाना चाहिए, या फिर प्रेग्नेंट वुमेन पे या मदर्स पे, एक्सपेक्टेंट मदर्स पे कभी कभी बहुत प्रेशर्स होते हैं, घर से ही बहुत प्रेशर्स हो जाते हैं कि नहीं जाना चाहिए, एंड डेंटल प्रॉब्लम इज समथिंग जो कभी भी हम उसका ध्यान रख सकते हैं, इट्स नॉट अ बिग डील. सो सर, इन योर एक्सपीरियंस, आर देयर एनी persistent myths or misconceptions among pregnant patients, regarding dental treatments, and how would you counter them?
Yes, there are certain myths. The first myth is that if he or she get treatment, it will affect the health of the newborn baby.
जी
But
जी
I must say that will improve the health of newborn baby rather than having disadvantage. So
हाँ
one
जी
myth is this. Second myth is if he or she, matlab her husband and she said ke we want to go for any surgical intervention, which
जी
sometimes, so bleeding will be a problem.
हाँ जी
Excessive bleeding can give, you can say, some nutritional disbalance to patient, but it is
जी
not like that.
हाँ
Dental
जी
treatment is quite different and systemic health is quite different. So
जी
it must be addressed immediately. So
हाँ
blood
जी
loss, having defect with the newborn baby. So these two, three myths are very common
जी
among families. So that need to be taken care with the consultation of gynecologist and dentist.
हाँ जी हाँ जी. So यहाँ पे इट्स वेरी सिंपल ना कि अगर आप बात कर लें और अपने घर वालों की बात अपने डॉक्टर से करवा दें तो probably that problem can be addressed
Yeah.
on time. और मदर भी सफर नहीं करेगी unnecessarily, because dental problems can actually be very very uncomfortable, right sir?
True.
ठीक है. एंड नाउ कमिंग ऑन टू समथिंग जिसपे आई थिंक हम और आप दोनों बहुत टाइम से काम कर रहे हैं, हम सभी बहुत काम कर रहे हैं, रादर सारे डॉक्टर्स काम कर रहे हैं, एंड दैट इज यू नो हेल्थ लिटरेसी पे. तो सर इसी से जुड़ता हुआ एक सवाल है अभी कि हाउ डज अ वुमेन्स लेवल ऑफ हेल्थ लिटरेसी would influence her decisions around oral hygiene during pregnancy, and what role can healthcare providers like yourself play in closing this gap?
थिंग इज, एज आई सेड अर्लियर, ये जो मिथ्स है ना, इनको खत्म करने के लिए मदर का एजुकेशन लेवल इज प्राइम. If she
जी
is aware what best can happen to us, what worst can happen to us, then she can maintain good balance between the choices.
जी
Secondly,
जी
a mother with a good knowledge, theoretical knowledge and basic knowledge of behavior of the society, she can
जी
take care good of her balanced diet,
जी
nutritional diet, what exercise she can do, what she cannot do, है ना?
जी
Rather than
जी.
keeping a wrong faith on some wrong person, she
हाँ जी
herself can evaluate the status and act
हाँ जी
accordingly. So
जी
education level is must
हाँ जी.
to certain
एंड
level.
अच्छा सर, इसके बावजूद में ना मैं आपसे थोड़ी सी गाइडेंस चाहती हूँ, क्योंकि आजकल हम लोग ना इंस्टाग्राम पे और बहुत सारे सोशल मीडिया प्लेटफॉर्म्स पे बहुत सारे सोशल मीडिया इन्फ्लुएंसर्स को सुनते हैं,
Hmm.
एंड वहां से ज्यादातर क्या होता है ना, बिकॉज मदर्स दे आर यूजुअली ऑन फोन्स, और ये टाइम ऐसा ना कि हमें चाहिए थोड़ा एक स्ट्रेस बस्टर की तरह से हम वो स्क्रीन टाइम यूज करते हैं. सो वुड यू सजेस्ट कि इस तरह से किसी को बिना किसी जानकारी के या बैकग्राउंड चेक के फॉलो करना इज द राइट अप्रोच टूवर्ड्स हेल्थ लिटरेसी?
No, no, no. I
नहीं.
don't support this. No, I don't
हाँ जी
support this. I am
हाँ जी
against this unscientific literature पे support करना.
बिल्कुल.
बार बार questions में भी I replied that kindly
जी
take your gynecologist and dentist in loop.
जी
उनको सुनो, उनका करो, but implement मत करो.
हाँ जी. वो इलाज
सुनना
नहीं कर
और
सकते.
इम्प्लीमेंट इलाज नहीं कर सकते, क्योंकि यू नेवर
हाँ
नो
जी
कि उन्होंने वो किस पर्टिकुलर पेशेंट के कंटेक्स्ट में अपना
हाँ
वो
जी
दे रहे हैं ट्रीटमेंट
बिल्कुल.
मॉड्यूल. तो
हाँ जी,
each person is individual, each body is individual, each
हाँ
reaction
जी,
physiologic, pathologic, microbiologic सब कुछ different है. तो
जी,
अपनी body को अपनी तरह से maintain करो.
Hans. Right, sir. Right. So I'm just going to summarize this wonderful session with the final question, sir. That based on your experience, can you provide a simple trimester-wise to-do list that expectant mothers can follow to ensure optimal gum and overall, oral health?
Okay. So as I said, first trimester,
हाँ जी,
consult your dentist,
हाँ जी,
follow his instruction,
जी,
अवॉइड अननेसेसरी स्ट्रेस. बिकॉज
जी,
अगर शुरू के ट्राइमेस्टर में स्ट्रेस होगा तो वो बहुत सारी चीजें हैं जो आपके अगले दो ट्राइमेस्टर थर्ड ट्राइमेस्टर में गम्स पे रिफ्लेक्ट करेंगी. बिकॉज गम
जी,
डिजीज इज ऑल्सो रिलेटेड टू स्ट्रेस ऑल्सो.
हाँ जी,
देन सेकेंड ट्राइमेस्टर में इफ यू फील के यू वांट एनी ट्रीटमेंट, सो दिस इज द
हाँ जी,
बेस्ट टाइम.
हाँ
सेकेंड
जी,
ट्राइमेस्टर ऑप्ट कीजिए, अपना सारा ट्रीटमेंट आप करा सकते हैं, सर्जिकल का कोई कॉन्ट्रा इंडिकेशन नहीं है.
जी,
Secondly, maintenance of good oral hygiene, brushing twice daily, use proper mouthwash, use flossing at least once in daytime.
जी, जी,
Third trimester again, which you can avoid, kindly avoid, but maintenance of oral hygiene again is a key to success. तो
हाँ जी,
अगेन आई समराइज, फर्स्ट ट्राइमेस्टर में अपने डेंटिस्ट को कंसल्ट कीजिए, अपना डाइट
जी,
चार्ट बनाइए, अपना
जी,
न्यूट्रिशनल बैलेंस चार्ट बनाइए, उसको इंप्लीमेंट कीजिए.
जी,
सेकेंड ट्राइमेस्टर और थर्ड ट्राइमेस्टर में मेंटेनेंस एंड प्रिवेंशन ऑफ एनी फर्दर डिजीजेस आर इंपॉर्टेंट. सो
जी,
यूज ऑफ प्रॉपर माउथ वॉश, ब्रशिंग ट्वाइस, फ्लॉसिंग सिंगल इज अ की टू
हाँ जी.
सक्सेस.
Ji, sir. And on that wonderful note, I really appreciate your presence with us today, sir. And I am hoping that the insightful information shared, it will be of great value to all the expectant mothers out there. So thank you so much for joining us. It's really been a pleasure.
थैंक यू डॉक्टर.
Thank you so much.
बाय.
And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again. Thank you.
गुड डे एवरीवन.